Hi, I'm Roxanne. And this is my volunteer patient. Um, I'm going to be completing an abdominal assessment. Okay, how old are you?
14.
How would you say your appetite is?
Good.
Do you have pain in your stomach
No.
at all? Do you ever feel nauseated
No.
on a chronic basis? Do you have any digestive problems? Do you ever have blood in your urine or in your bowel movement?
No.
Okay. Do you have any issues with diarrhea or constipation?
No.
Okay. Are you pretty active?
Yes.
Do you exercise on a regular basis?
Yeah.
Okay. And do you have any family history of cancers, of like colon cancer or stomach cancer?
No.
Okay. So what we're going to do is I'm going to be assessing your abdomen, so I'm going to have you lie down. Okay? Okay. So I'm going to lift your sweatshirt here just so that I can see your belly. Okay? And the first thing that I'm going to start with is I'm just going to be inspecting. So I'm going to be taking a look at her stomach to make sure that things are even and symmetrical. I'm going to make sure that there's no lesions or masses, and that there's no scars, because if she would have any scars, then you would be concerned with possible adhesions internally. But everything looks even and symmetrical, and everything looks good. Okay. I'm going to also be looking to see if I can see the pulse of her aorta, which I can see, and see if I see any waves of peristalsis, which I don't see at the moment. Okay, the next thing that we're going to be doing is I'm going to be auscultating. With the abdominal assessment, you want to auscultate as your next step, because if you did percussion or palpation, you would be creating bowel sounds. And they would be, active bowel sounds that might not be there if you did not do percussion or palpation. So I'm going to be listening to her bowel sounds in all four quadrants. So her right upper quadrant of her abdomen, her left upper quadrant, her right lower quadrant, and her left lower quadrant. So I'm just going to use the diaphragm of my stethoscope and listen. Okay, and she does have bowel sounds, and they're nice and gurgly, so nothing extra active or inactive, so that's good. Okay, and then I'm going to use my the bell of my stethoscope, and I'm going to be listening for bruits. I'm going to be listening for bruits, her renal artery, her aorta, the iliac arteries, and the femoral artery. So this is for the aortic artery. Okay, and then renal arteries. Okay, and then the iliac arteries. Okay, and then the femoral artery would be here. Okay, and then I don't hear any bruits. I'm also going to be listening for friction rub in her liver and her spleen. So the liver is in the right upper quadrant under the costal margin. Okay, and then for her spleen. Okay, and I don't hear any friction rub, which that would be normal. Okay, now what we're going to be doing is I'm going to be percussing each of the quadrants. So again, like we typically percuss, we're going to be tapping on the middle finger of your non-dominant hand, and what we're expecting to hear is tympani, okay, because of the air and in the belly area. And then as we're percussing, we would expect to be hearing dullness in the area of the liver. Sorry. Okay, sorry. Okay, and then once you get to the point where you feel the dullness, and that's going to be the mid-clavicular line going down to the costal margin, then you're also going to be doing tympani down from the lung area, so you're listening to resonance going to dullness, and so that's what we're going to be doing. Sorry. Okay, so you were about dull right here. Sorry, and then we're going to go for okay. And so what you would do then is you would be measuring that, and it should be 6 to 12 centimeters. Okay. And then for your spleen, with percussing your spleen, you're going to be at your mid-axillary line, and it should be just posterior to your mid-axillary line. Okay. Sorry. Okay, and your spleen, you should be seeing that you've got dullness between your 6th and 10th rib. Next, what I'm going to be doing is I'm going to be palpating, and one of the things that I want to be palpating is I just want to be using just light palpation to start off with, and I want to be seeing if there's any bulges or masses that I would feel. I can also feel for the aorta. Okay, which I can feel the pulse of the aorta. And then that light palpation is then going to go to moderate palpation. Okay, and we're going to see if you have any pain. You let me know if you have any pain in any areas. I know that this is ticklish. Okay, and then it would go to deep palpation. And so for a deep palpation, we'd be checking for things like we're going to do deep palpation in the right lower quadrant. Okay, right here. And I want you to tell me if you have any tenderness or pain, okay, if I palpate deeply. No? No? Okay. So for a deep palpation, you're going to see if the person, you're checking for appendicitis. So you would, appendicitis usually starts in the umbilical area in the beginning, and then it goes to the right lower quadrant, and the person would have rebound tenderness. You could also palpate for the liver, the edge of the liver. Sometimes you can't feel it. If you do feel the edge of the liver when the person takes a deep breath, if you feel the edge of it, it should be smooth. There should be no nodules. Same thing with the spleen. You would be feeling for the edge of the spleen. And you know, sometimes you don't. If you do feel something like the gallbladder, you shouldn't be feeling the gallbladder. That may mean that the person's gallbladder is inflamed. So other things to check for appendicitis is I would have the person bend up their leg a bit, and I'm going to push down while they try to raise their leg. And do you have any pain? No. Okay. So that would be another thing that would be checking for appendicitis, to see if the person has any issues there. Okay, and then we could also do bend the person's leg up, move it to the side, see if the person has any pain doing that. Okay? You can also do something called the scratch test for the liver to check if the liver is inflamed. So everything is normal with this particular person. The kidneys, if you wanted to palpate the kidneys, you could actually put one hand underneath the back, and then you can palpate deeply on the anterior side, and you would ask the person to take a deep breath, okay, and you would feel if you could actually capture the kidney and feel the kidney slide past, and you would do that with both sides. My volunteer patient is doing well, has no abnormalities, and I thank you for your attention. This is the end of our abdominal assessment. Thank you.